the amount of time that's being dedicated to talk about this. Clearly a topic of interest, but so how would you describe the current sort of state of life end of care, or rather the state of end of life care in NMD, from your perspective?
The point that you make, that the fact that we're taking time to talk about it, it's part of national platforms, is huge. It really reflects how the state of the field is evolving, that certainly there has become an increasing understanding of that need to better the end of life care for patients and people who are living with neuromuscular diseases across the board, not just maybe ALS, but all of the neuromuscular diseases. And yet it is still really not implemented equally across the diseases or across clinical centers. And I know we'll talk about that in the rest of the session a little bit, but there are discrepancies in where really excellent end of life care can happen. And that somewhat is based on the access to the healthcare professionals who have neuropalliative expertise or end of life care expertise. Many of those are really at certain academic centers. And we still have a long way to go in terms of the research perspective on really getting that high quality evidence, which is a little bit lacking at this time. And that's what the Muscular Dystrophy Association is helping to do and lead the field forward on that. We're trying to think about all of this, not just really at the end of life and in the last few hours, days, weeks, but really throughout the entire patient's journey. And that's, I think, what we're starting to focus on and make movements towards that.
Outside of just kind of increasing conversations, what's kind of been the biggest change for this realm of care, just in terms of, again, like the inclusion in the process and just how it's kind of discussed?
Yeah, I think there's two major things that have changed. One is that there's really been an understanding that there is a difference between palliative care and hospice care. And hospice care really is the focus at the end of life, really the last few hours, days, weeks. But palliative care, as we're saying, being proactive, prospective, starting as early as disease diagnosis. And increasingly, there have been more and more efforts at making sure there are neuropalliative experts with the focused knowledge of what palliative care is, and then how to guide those patients and care partners into good hospice care, and making sure we're maximizing the resources that they get, the quality of that care. And so, with increasing things like there's more research, there's more formalized training programs. There are more neurologists getting palliative care expertise. There's more palliative care docs like me who are embedding into neuromuscular disease clinics. There's the increasing presence of that high quality difference between palliative care and hospice care and access to both of those. I think that the other big part of it is the organizations like Neurology Live, like Muscular Dystrophy Association, like the International Neuropalliative Care Society, that partners a lot with these two groups on empowering patients and care partners. And so having that advocacy, and where we're teaching the really not just teaching the patients and care partners, but partnering with them to empower them to ask for these resources, and knowing what they can and really can get to improve these phases of their life. I think those two aspects are really coming together to change the field.